Sonia Jai Shri Krishna, Jai Jinendra, Jai Swami Narayan, Sai Ram. Good evening to you all. I hope everybody is in good health. So, in this final session of our Health and Wellbeing series, Dr. Zander van der Walt delivered a high informative, engaging talk on headaches and migraines, understanding causes and self-care. Drawing from his extensive experience as a practicing chiropractor since 2008, Dr. van der Walt explores the anatomy of the brain, spine, and soft tissues relevant to headaches and migraines, and the various types of headaches and migraines and how they differ in symptoms and causes. So let's invite Dr. Zander. All yours, Dr. Zander. Good evening to you. All yours.
Can everyone hear me?
Yes, we can.
Okay. As I was saying, thank you for the introduction. Thank you everyone for joining. For those new, welcome. For those faces that I can see and remember, welcome to you as well. So we're going to talk about obviously headaches and migraines and the most common types of headaches and migraines and how we can understand a bit more about how we can look after ourselves And by the end of it, hopefully you'll have a better understanding from things. So can everyone see my screen?
Yes.
Okay, so what we'll be talking about and covering is a bit more history about headaches and migraines, how common they are, who affects them, why we get affected, the different types of headaches, because there are lots of different types of headache, as well as migraines, and then some ways and means for you to help yourself if you were ever to suffer with any headaches or migraines. I'll give a couple of basic stretches at the end, just to show you some basic stretches you can do to help if you were to suffer with any headaches or migraines. But obviously, that's just on a generalized basis. So, in terms of who gets affected with headaches, this is taken from the World Health Organization website. So, as you can see, it affects quite a lot of people worldwide. So, 4 years ago, 3.1 billion people on the planet were affected with headaches and migraines. There are more common in females, middle-aged females. Why that is, it's possibly and most likely due to hormonal changes and hormonal imbalances. And headaches, and especially migraines, migraines is the most common neurological condition on the planet, for reference. Now, me as a chiropractor, my job is to ensure that your nervous system is as healthy as it can be. So, for those who are new, our nervous system controls everything in the body. For those who aren't new, this should be something that you should be aware of and know by now. So, our brain is protected by the skull. Now, the skull, as we're born, is soft. Even a normal healthy delivery, there's a 60 to 90 pounds of force which goes into a baby's head and neck. So that's a normal delivery. If the baby then is born via things like a C-section or a ventouse delivery, you can imagine how much stress and pressure is then going to be applied to the brain. Because obviously the skull is not rigid, it's soft and pliable. So that's one of the reasons why chiropractors would work and assess babies, because we want to assess if there's any stress on the brain. However, as a chiropractor, our role is to work on your spine because your spine protects your spinal cord and the nerves, which is what your brain uses to control all of these systems. Now, headaches and migraines are linked with imbalances in your gut. They are linked with stress as well, because on top of your kidneys, these are your adrenal glands. So our adrenal glands release our stress hormones. Okay. And then they are also linked with your muscles, which I'll explain a little bit later. So as I mentioned before, however, for those who are new, I'll cover it again. The way our body works, remember, is that the brain sends information down the spinal cord out of our nerve roots to every part of every part of the body into each of these systems. So nothing in our body happens and works without a signal. The skull obviously protects our brain, whereas the spine, 24 joints protect the delicate spinal cord and then these nerves which exit. So as a chiropractor, my role is to assess the health of your spine, to assess for whether or not that is putting stress on your nervous system. The only way your body can tell you something is wrong is through triggering a pain or a symptom. Headaches and migraines are a very common symptom, but they are from an underlying problem. So my job is to assess the big picture and ask you questions about how is your diet? How is your lifestyle? Do you get stressed? Okay. Are you sleeping properly? etc., etc. So we can build a picture so we can understand why your body is triggering a symptom rather than trying to mask that symptom or treat that symptom. Now remember, each of those nerves which come out of the spine have three functions. They have a function to control our muscles. Now, if a muscle is tight, obviously a muscle attaches into the occiput, into the spine. So if a muscle is tight, that joint in the spine isn't going to move properly, and eventually it would lose its normal alignment, for example, something like that. The nerve also has a function to control your blood vessels and your organs and your glands, but it also controls pain, touch, temperature. But that is only 10% of each of these nerves' functions. How our brain works, the spinal cord, which is your information highway, remember that sends electrical and chemical signals through the rest of your body. Now that is encased in water. When we get dehydrated, our electrical signals get slowed down. So it's very important that you stay as hydrated as you are, because one of the causes of headaches are a lot of times dehydration. It's just called the dehydration headache. So make sure you drink at least roughly about 2.5 liters of water every day. That is the minimum standard that everyone should be aiming for. Now, the parts of our brain which controls different functions, we have the cortex, which is the top part of the brain in here. So that controls things like your memory, your thinking, your learning, and your emotions. Okay. The back part of our brain, which is in here, this is called the brainstem. So in our brainstem, we have what's called the cranial nerves. So the cranial nerves are 12 nerves, which control your sense of smell, your vision, your eye movements, your facial expressions, all of the organs. So that's the vagus nerve, which we talked about previously, as well as the neck and shoulder muscles, amongst other things. So if there is stress on the first two joints in the neck, which are called C1 and C2, it then affects the function of the cranial nerves. So the 11th nerve is called our accessory nerve. That nerve controls one of your main posture muscles, which is called the trapezius. So that's this big muscle in here, which comes and attaches into the skull, and it runs down and attaches into the side of the shoulder, and then it runs all the way down to your middle back. So when that muscle gets tight, it can give you referred pain from the back of the head, around your ear to behind your eye. That's called a trigger or a pressure point. So every muscle in your body can develop a pressure point, which I'll talk about later. But that is the referral pattern for that particular muscle. So it's fine working on stretching the muscle and massaging or icing it or whatever, or hot water bottle. However, if that joint in your spine is not moving properly, it is always putting stress on that part of the brain, meaning that the brain can't control the muscle properly. So the muscle is never going to heal and function properly. So that's why my job as a chiropractor is to assess your spine and keep it as healthy as we can do. Again, we talked about this previously in terms of how important your posture is. Again, the trapezius, which is this muscle, that is one of the main posture muscles. So when you're looking down on things, whether that be washing the dishes, brushing your teeth, doing housework, using your phone, reading, that is the muscle which has to carry the weight of your head. And if that keeps happening all the time, obviously we are going to build up lactic acid and tension and sore spots in the muscle. And eventually it can lead to then, like I said, that referral headache into that characteristic pattern. However, your posture is also important because, as I talked about before, if you have forward head posture, which is this, it leads to, amongst other things, your spinal cord, which remember is this, getting stretched by 5 to 7 centimeters. So when the spinal cord is stretched, again, that puts a lot of stress on the brain. And again, as a symptom, the brain might create or develop a symptom of a headache or a migraine. Does that make sense? Okay. Now, how I assess your posture would be to take posture photos. So this is obviously you can see the changes. This is 2 months from a while ago, but you can see significant improvement in the head position in this patient, meaning obviously it's a lot less stress on the brain, less stress on the spinal cord, less stress on the spine, and less stress on the muscles. Okay, so types of headaches. We have firstly sinus headaches. So our sinus headaches is normally this area. Okay. Now, doing and practicing some breathing exercises proactively would be always beneficial to help with getting more oxygen into your body. And also, like I talked before, by doing breathing exercises, we are calming your vagus nerve, which remember we talked about before. But also, when you're practicing breathing exercises, you're actually working on improving the function of your sinuses. Most people are sinus breathers or chest breathers. A lot of people don't breathe from the diaphragm, which is where you should be breathing from for reference. So there are lots of different ways that you can work on breathing to get your sinuses clear and to get them working properly. I'm not going to go through all of them. However, you can do one, which is very simple. You close one nostril, breathe in, close the other nostril, breathe out through this nostril, and then just keep repeating. So keep this one closed, hold, breathe out. That increases the oxygen and blood supply to the brain because obviously the brain controls opposite parts of the body. So left side of the brain controls the right side of your body, whereas the right side of the brain controls the left side of the body. So when we're practicing breathing through the sinuses, we are increasing the oxygen supply to the different parts of the brain, which is always a good thing. Other things you can do if you were to have a sinus headache is just to do some pressure points. So that's basically just massaging the sides of the nostrils here, and then just above the eyebrows. So either you can just go from the eyebrows down or just a circular motion like that. Okay. Next is we have a cluster headache. A cluster headache is probably one of the worst headaches we can get. They are quite rare, but it's something obviously I'd like you to pay attention to. Cluster headache, I've had people come in with a cluster headache and they're crying. Their eye is tearing, so much water coming from the eye. The face is sometimes down, the eyelid is drooped. And sometimes people say it feels like someone is poking me in the eye with a hot needle. So they are quite excruciatingly painful. You might get a stuffy nose as well, but usually the classic is a severe, intense one-sided headache, poking eye, drooping of the eyelid, and then obviously the tearing of the eye as well. Now, this one is a muscle referral. So I mentioned what pattern the trapezius muscle refers into. However, there are other referrals which the muscles can refer into as well. So this is the trapezius, which I just mentioned. Okay, so as you can see, it refers behind the back of the head, around. These intense red areas are the areas of high intensity of pain. So as you can see, it would normally be the back of the head, sometimes around the jaw, and then the back of the eye. Okay. Then we have this muscle, which is called your SCM for reference. It helps to rotate your head side to side. And for reference, the 11th nerve in the brainstem which controls the trapezius, also controls that muscle. So that muscle, again, is similar to the referral for the trapezius, which is basically about the back of the head and around kind of the eye area. Okay. Then we have all of these other referrals, which I'm not going to go through, but you can see yourself. Okay. Then we have a tension headache. Tension headache is probably one of the most common types of headaches, and they cause a lot of disability in a lot of people. Essentially, you can imagine a tight band around the head. So that's what a tension headache would feel like. So massaging your temporal region, just in a nice, smooth circular motion, that will be one easy and effective way to help alleviate some of the tension. Okay. Now, people who get stressed, or if you're clenching your teeth, they are usually more, sorry, I've lost the word. They're more likely to develop tension headaches. So for those people who clench the teeth at night, it might be useful to consider wearing a mouth guard, because obviously when you're clenching your teeth, you're clenching all of the muscles around the skull, the neck, the face, etc. And you're putting tension on your jaw as well. And a jaw headache, which is a TMJ, could also be a type of headache. So that's normally kind of around this side of the face or the other side. Obviously, just the area where we have the jaw. Then we have headache called cervicogenic. So this is probably one of the most common types of headache. So cervicogenic literally just means headache arising from your neck, usually from number one, number two, number three, or number four joints in your neck, which is then compressing the nerves, and then obviously those nerves feeding into the brain and into the neck. So as a chiropractor, that's easily fixable. Okay. Then we have exertional exercise. So any type of physical activity can trigger a exertional type of headache. Okay. So whether that be going for a run, cycling, going up and down the stairs, whatever it is, you can get a headache just from exercise. Okay. You can also get obviously medication side effects as well. Then we have another severe type of headache. So this is called trigeminal neuralgia. Your trigeminal nerve is one of the nerves in the brainstem. It has three branches, one around the occipital region, one around the cheek, and one around the jaw. So these are the three branches for it essentially. Now, again, when we have stress on the brainstem because of usually the first two joints of the neck shifting out of alignment, it therefore affects those 12 nerves. And then you can develop trigeminal neuralgia. So it causes facial pain either in the whole side of the face or one or two or three of the branches of that nerve. Okay. They're more common from about 50 years old. And I believe they are more common in males for some reason. Okay. Now we can also get headaches from blood pressure. If your blood pressure starts going up probably from around 150 plus, from my experience, then the chances of developing blood pressure headache usually increases. Now that's usually back of the skull area, sometimes the top of the head, but usually the back of the skull. So if you have a headache in that particular part of the head, then I would recommend that you check and monitor your blood pressure, especially if you suffer from blood pressure issues. Okay, and then we can also get headaches from nutritional deficiencies. So if you are deficient in any of these minerals, you can get a headache as a result of that. Okay. So that's why it's important that you eat the right food. So vitamin D, obviously you get sunlight. Now, unfortunately, in the UK, we don't get enough sun. So from around September to about now, that whole period, you need to supplement with vitamin D. You get a little bit of vitamin D in eggs and some other foods. However, you need to supplement with it unless you can happily travel abroad and get some sun. Otherwise, like I said, you can just take the liquid drops, which will be sufficient. Okay. Magnesium, for reference, is a very important mineral in our body. It helps your muscles work properly. So your muscles need sodium, potassium, and magnesium to work properly. If you're deficient in magnesium, your muscles can't function properly. And again, we saw earlier, if your muscles don't work properly, then we can develop lactic acid, and eventually we can develop a trigger or a pressure point in the muscle. So you don't have to just get magnesium through your diet to help reduce your muscle tension and to get more magnesium into your body. You can take and use magnesium cream or spray or lotion. Personally, I prefer the lotion just because it's easier to apply. The brand that I can recommend, which you can get online or you can get it from Holland and Barrett or most health shops, the brand is called Better You. Now, obviously, just make sure that you don't have any allergies to any of the ingredients, but you shouldn't because it's a pretty natural product. Okay. So again, it's Better You magnesium lotion. Okay. And then just apply that around the neck and shoulders and then just up into the neck area as well. You can use it anywhere, especially if you're feeling any aches or pains. But obviously, just for reference, because we're talking about headaches and migraines, as a minimum, like I said, around the neck and shoulder area. Okay. Now, in terms of migraines, ladies, unfortunately, you're more prone to developing migraines. Like I said earlier, most likely because of your hormonal system and obviously what changes we go through. Now, we have two types of migraine. We have migraine with an aura, which is a bad one, or we have a migraine with no aura. So we'll start with the bad one first. So migraine with an aura, you might have deja vu before it actually starts. So deja vu is you might basically remember, okay, you're doing something and you just remember, oh, this happened before. So that's basically deja vu. You might get things like zigzag lines. You might get flashes of light. You might be really sensitive to the light. A lot of people might have to sit in a dark room or have to wear sunglasses. Might have nausea, might have some vomiting. You might have an upset stomach. You might get tinnitus, which is a buzzing or ringing in your ears. You might also feel, depending on how bad it is, your heart rate increased because your body is in a stress response. And you might feel that your breathing is increased as well. So again, that's where the breathing exercises, especially the alternate nasal, can help. Because obviously, like I said before, when you're practicing breathing, you're working on your vagus nerve, which is the main nerve which will slow down everything. So it's basically just calms your body down. Does that make sense? Now, for reference, I do recommend if you are suffering from headaches or migraines, that at least as a minimum you have your eyes tested if you haven't done so recently, because a lot of times we strain our eyes. And obviously, because of the connection between the eyes and the brain and the muscles and the neck and the joints and everything, it's just a very simple test. Okay. And if you need to wear glasses when you're reading or using the computer or watching TV, just wear glasses because you might not feel like you need them. However, you are physically straining your eye muscles and your optic nerve. So just bear that in mind, okay? Migraine without an aura is basically just a generalized headache, but it doesn't have any of these associated symptoms. Stress triggers headaches and migraines, so don't stress. Again, if you do get stressed, like I mentioned before, the best and easiest and quickest way for you to get your body back into a state of calmness and ease is to breathe, because we need to get your vagus nerve calm. And that vagus nerve, remember, starts in the back of the brain and it goes into all of your organs. So it's regulating your heart rate, it's regulating your breathing, it's regulating your just digestive health, it's regulating your immune response, it's regulating your kidneys, it's regulating everything. Okay. Again, when we get stressed, one of the things that happens is your muscles start to degenerate over a period of time. Because when you're stressed, your brain wants nutrients because your body is in a stress response. So what it does, it starts leaching and taking nutrients wherever it can, whether that be from your bones or from your muscles. Okay. And that's why stress is the biggest problem on the planet. So again, we talked about this previously, but again, just as a recap, to help with your vagus nerve, so your brain and everything is calmer and your muscles aren't as tight, everything is relaxed, smile. Take a probiotic, so kimchi, sauerkraut, whatever probiotic drinks you want to take. Just give me sing, smile, dance, chant. That's where when you're breathing or doing yoga, it's very beneficial for your vagus nerve. Okay. Don't eat foods or drinks that can trigger an inflammatory response in your body. So with migraines, there are things like chocolate, red wine, alcohol, dairy, uh, sometimes carbohydrates as well, because it's essentially glucose, which is sugar. And you also have to be careful with fruits because sugar has different parts. We have fructose, sucrose, galactose, etc. So we have different types of strains of sugar. And certain fruits have a higher level of certain natural sugars. So you need to be careful with what particular fruits you're eating. Okay, because every time you eat something that has sugar, whether that be a good or a bad sugar, you will get a glucose spike. And we don't want that. Don't eat everything in red and do eat everything in green. Your intestines, for reference, is the size of two tennis courts and it's only one cell thick. So it's very, very thin. Now, what happens is when we get stressed or when we get emotional or if we take lots of antibiotics or medications or whatever reason, we can start to get little tears in the intestines. And then we can develop a condition called a leaky gut. So has anyone heard of a leaky gut before? Okay. So a leaky gut is essentially whatever you're drinking or eating starts to slowly seep into your body, into your bloodstream. And your brain and your body, in its amazing wisdom, thinks this is a foreign invader. So what does it do? It wants to fight it. So your body is literally fighting itself. So that's what's called a autoimmune disorder or disease. So that's why it's really important that you feed your body the correct nutrients that it needs. Because again, if you're getting headaches or migraines, you want to look after your gut health. That should be number one priority. Also, how those nutrients and things can go into your brain is through this barrier. It's called your blood-brain barrier. So there's a barrier between your blood and your brain. Now, over time, that can start to, same like the gut lining, it can start to degenerate. And then chemicals and toxins can seep from your blood into your brain. Okay. So again, you want to limit things like heavy metals because they are toxic to your nervous system and to your brain. So heavy metals would be, for example, things like mercury, lead. Where do you get mercury? Anyone know? What's the most common use for mercury? Correct, Doris. Tooth fillings.
Thermometers.
Yeah, yeah, but also tooth fillings.
Mm.
So if you do have silver fillings, I do always recommend to my patients at least to try, obviously depending on your case, to have them extracted as safely as possible. Then we have things like lead and aluminium. So aluminium we get in antiperspirant sprays. So you get aluminium salts because apparently it blocks your sweat glands. But again, that seeps into your body through your skin, which is your biggest organ, into the bloodstream, and then over time it can then end up in the brain. And then as a result, you might get a headache or you might get a migraine. So be careful with what you put in and on your body. Now, some basic stretches. This is to stretch your trapezius, which is this muscle in here, which I mentioned earlier. So very simple. Sit. Just move your head slowly to the side until you feel the stretch. And you want to hold that for, if you can, at least 10 to 15 seconds. Ideally, you should be able to hold the stretch for over 30 seconds because that's actually the time where you actually start to stretch the muscle fibers. But again, if you're starting off with it, I'd normally say for about anywhere between 5 to 15 seconds. Just a nice slow contracted movement, hold, and then relax, and then repeat. Same on the other side. Okay. Next, you just want to do some basic shoulder rolls. So you can sit, you can walk, you can stand, it doesn't matter, just to keep the neck and shoulders nice and supple. And then just do some basic side tilts. Okay, trying to bring the ear to the shoulder. Then you don't have to do it sitting. You can do it in bed, or you can just do this in a chair, just to help a little bit rotate the muscles. You can do this stretch. Otherwise, you can just grab a chair, preferably one that has armrests. Grab the back of the armrests and then just slowly turn and try and look over your shoulder. Okay. Obviously, make sure that you're breathing whilst you're doing that. Okay. Then, for those who are familiar with yoga, the cat camel or cat cow exercise is very good, just as a way to open up your rib cage and at the same time get the lungs expanded and to stretch all the affected muscles. Okay, just for consideration, if you can do this, I don't normally recommend just to get like a towel or something just to rest your knees on. Okay. And then again, a yoga pose, just the child pose. Okay. Just sit if you can, and then just nice and feel the stretch all the way down your spine. Maintain good posture as much as you can. When you look at your spine from the side, that's what it should look like. Nice and straight. Okay, get the shoulders back, tuck the chin back, make sure everything is nice and level. That's your ideal posture. If you have that good posture, at least the brain is not, and the spinal cord is not under strain. Okay, last couple of things, because I know it's late. As a chiropractor, this is what we work on. Essentially, it's a joint in your spine which is not moving properly, which has lost its normal position in relation to the joint above and below, which then affects the information to your brain. Okay. If we have misalignments in the upper neck, which is what I mentioned earlier, like I said, it can affect those nerves in the back of the brain, which is your cranial nerves. And the 11th one, which I mentioned earlier, is the muscle, the one which controls this muscle, which is the SEM that helps to rotate your head, and then the trapezius as well. However, the other important thing I want you to take away from this is that if you have a blockage or a restriction in this part of your neck, it can also lead to your cerebrospinal fluid getting blocked. So your cerebrospinal fluid, or your CSF, is the fluid that flows around the brain, which the brain uses to clear itself of toxins and just to keep everything clean. So when that becomes blocked, again, as a symptom, what might you experience? A headache or a migraine. The other issue is that it affects the blood supply to the brain. This is the first joint in the neck. This is the second. This is the third. The yellow things are the nerves. The red is the artery, which takes 20% of the blood to your brain. As you can see, that artery travels through these joints in your neck, and then it comes around C1, and then it supplies 20% of the blood to the back part of your brain. The back part of your brain, you have these nerves, remember? So if your brain isn't getting oxygen, because that's what your vascular supply does, obviously it can't control your body properly. Okay. So I mentioned that. Now, finally, again, as chiropractors, a lot of people have a misconception. Okay, chiropractors do not treat anything. I don't treat back pain. I don't treat neck pain. I don't treat headaches. I remove interference to your nervous system by adjusting your spine and keeping your nervous system healthy. By doing that, your body has the ability to heal itself. Okay. And what chiropractic actually does is all of these things. Okay. And for reference, since we're talking about it, is yes, it does reduce muscle tension. And again, if your muscles are less tight, it's less likely that obviously you can get that referral into the head. Also, it helps to regulate your blood pressure. Again, if you have high blood pressure, we can develop that headache at the back of the head. And it also helps to regulate and reduce inflammation. Okay, any questions?
I have one.
Yes.
So when should somebody seek professional help for headaches and instead of managing them at home?
You have to define how you want to manage headaches. So whether that be obviously taking a painkiller or drinking water or trying to do some self-massage, yes, you can obviously do whatever you want to. I can't recommend medication because I'm not qualified to recommend that. However, I prefer not to. However, my job is to assess why you're getting headaches and migraines in the first place, rather than trying to manage them yourself. So yes, you can do a lot of things. Like I say, you can do the stretches yourself. You can drink a lot of water. You can change your diet. But at the end of the day, you can't treat or adjust your own spine. Same thing with me. I can't do that. So I have to have regular, and I do have weekly adjustments because I have to keep myself healthy. There are some small things you could do, like I said, is, excuse me, drink enough water, do the stretches, maintain good posture, get enough sleep, eat a healthy, balanced diet, and just be proactive rather than what everyone usually does, which is reactive. Reactive healthcare is never going to get anyone healthy. Reactive means you get a pain, you get a symptom, and basically you want a quick fix. It's never going to happen because all painkillers do is they block the signals to your brain, telling your brain there's no problem. But problem usually stays there because if that joint is like that, it's going to stay there. It can't move back. And no painkiller or stretch or ice pack or whatever can fix it. It needs to be manually adjusted. Does that answer your question?
Yes, thank you. So, what are some common foods or ingredients that people with migraines should be cautious about?
Yeah, so like I mentioned earlier, it will be things like chocolate, red wine, coffee. Coffee is a big one. It can be caffeine as well. So especially if you're having a lot of green tea, you have to basically watch how much green tea you're having. Also, you have to consider if you are drinking tea and coffee is the most sprayed crop on the planet in
Mm,
terms of the amount of pesticides. So again, I would always recommend and emphasize that you try to have as much natural or organic as possible. Because the first time, for example, if you're drinking tea, the first time you're actually cleaning the tea is when you're putting in your cup and then you're drinking that.
mm,
So that's very important. So like I said, coffee or caffeine, chocolate, red wine, dairy, etc. Just do an elimination diet. So elimination diet, for me, the three biggest things for not just headaches and migraines, but just for inflammation, sugar, gluten, and dairy. If you eliminate that for at least 5 weeks, you should be able to notice quite significant changes and improvements in your health. And
Okay.
then you can do a reintroduction gradually of one. So, for example, you eliminate those three things for 5 weeks and you keep an eye on, okay, how's your headaches? How's your sleep? How's your mood? How's your digestion, etc.? How's your energy levels?
Mm,
Then the 6th week, you'd slowly, gradually introduce sugar for like a couple of weeks and see again, keeping an eye on those things. Then you gradually introduce dairy and then finally gluten. So that's the best kind of DIY in terms of diet that you can try.
right. So, how does dehydration relate to headaches, and what's the best way to manage it proactively?
When you get dehydrated, your skin gets dry and your muscles get tight because obviously your muscles need oxygen. Red blood cells carry oxygen around your body. Water is H2O, so it's two hydrogen, one oxygen.
Mm,
If you don't have enough oxygen, your red blood cells can't carry the oxygen-rich blood into not only your organs, but around the rest of your body. And since we're talking about it, into your muscles. So if your muscles don't get enough oxygen, what's going to happen? They get tight. And we get lactic acid and whatever else building up. So proactively, like I said, drink water. You can add anti-inflammatory things. So for example, you can add some lemon, or you can put some blueberries or mint. A, because you get some flavor, and B, because obviously you're getting some antioxidants and nutrients from that.
okay.
Anything else?
I have a question. My name is Mayuri. The spinal adjustments that you do, whether it's the neck or the lumbar spine, do they help in untrapping the trapped nerves?
Yes. However, you don't get a trapped nerve. That's a misnomer, and it's a wrong terminology. But yes, essentially, chiropractic does.
When there is pressure on the nerve because of the reduced disc space, degenerative disc, so that the two vertebrae are closer together and
Yep. So basically, if you look at your discs from the side,
Yes.
that's your disc, that's the nerve.
Yes.
Our discs should be nice and healthy. Now, for reference, your disc is about 70-80% water.
Mm-hmm.
Again, that's why you drink water, to keep your discs healthy.
Mm-hmm.
Now, if you're dehydrated over time, what happens is this process. So we go from normal healthy spine, muscles get tight, the joint doesn't move properly, it can't move back by itself. We have stress. When you get stress, you get cortisol, which negatively affects the disc's ability to heal. And then it starts to get dehydrated and degenerated. And then obviously when you start to get more stress and pressure on the nerve, and then we get to the stage, which is possibly where you are, where the disc, as you can see, is quite narrow. And because
Yes.
it's reduced, that means that the nerve has less space, and that
Yes.
therefore it then gets trapped.
Pinched. Yes. It's when there is a disc prolapse.
Yeah, so a disc prolapse would basically look like this.
Oh.
So then it presses on the nerve.
Yes. Okay.
And
And the nerve flossing exercise, will it help to sort of loosen the pressure, reduce the pressure on the nerve?
Which nerve is it? Is it sciatic nerve?
Is sciatic nerve and some nerves along the neck.
Okay, yes, so you can do a sciatic floss, which is basically where you're sitting and you would basically do this. Can you see?
Yeah.
So basically you will straighten out the leg, you point the toes down, and then you look down. And then look up, not too much, but just looking up and bringing your foot up at the same time. And then just repeating that. Down, look up, foot up. So that's the sciatic floss. For the neck, it
Yes.
depends on which nerve root is affected.
C5.
So we've got, yeah,
It's
so basically
C5.
we've got lots of nerve flosses where you can do things like this motion, tilting the head to the side, doing that, or doing the fingers, and then doing this type of motion. So again, it just depends on what your assessment or what your findings are.
Oh, you have to touch the fingers when flossing, doing a nerve floss. You
Yes.
have to touch the fingers.
Yeah, like I said, there's lots of different ways to move the fingers depending on which nerve you want to work on.
I see. Okay, fine.
I have a question, Doctor. Can you hear me?
Yes.
I'm suffering from neck pain, and it goes all the way down up to the shoulders. Now, by doing the exercise, neck exercise, it relieves it temporary, only temporary, or the painkillers. Now, somebody said osteopath. Now, what's the difference between the osteopath and chiropractor? Because I want to see someone who can sort the neck problem out.
Yes, that's a good question. I do get that a lot. There's basically three differences between chiropractor and osteopath. So chiropractors work on your spine for the assessment and the improvement of the function of your nervous system. Chiropractors are trained to take and read X-rays to the same degree as a medical radiologist. Okay. So for reference, we do over 300 hours of training on radiology, which is looking at X-rays, compared to medicine, which is, I believe, about 20 hours. And then we perform different types of adjustments. So we don't perform spinal manipulation, which would be a large, gross, big movement of the spine. We perform a spinal adjustment, which is a specific force manually, usually, applied at a specific level of the spine with a specific amount of pressure. The reason chiropractors would usually take X-rays of your spine is check for fractures, dislocations, arthritis, tumors, curvatures in your spine, and make the treatment and the recommendations that we give you a lot more specific. So
How long?
osteopaths would not take x-rays because they're not trained to do that.
So how long should you wait before you actually see? Because I've been suffering for nearly 3 to 4 weeks now. So would you say it's about time I saw to a chiropractic?
Why should you wait for pain to have a healthy spine and healthy nervous system?
Right, okay.
You don't go to your dentist when your teeth are falling out, do
No.
you? So you brush your
Okay,
teeth
so
and you
it's
floss, and then you go for regular
because
checkups.
it's been on and off, on and off. So, you know, that was the reason.
Okay.
Sorry.
Pain is your brain's way of telling you there's a problem. However, your health should not be dependent on how you feel. Being healthy is getting enough sleep, doing regular exercise, eating a healthy, balanced diet, and having your nervous system working. Because if your nervous system is not working, everything in the body doesn't work properly. Because as I mentioned earlier, your nervous system controls, remember, every function in your body. Can you still see my screen?
Yes.
Yeah. So if your nervous system
We
isn't
see you,
healthy,
not your screen.
Yes.
now,
Yes.
okay.
Yes.
As I mentioned, your nervous system controls everything in your body, including pain. So if you don't have any pain, you don't know that any of these systems are not functioning optimally
Right.
until your brain triggers a problem. So don't wait for a pain or a symptom or a disease to then kick in, because 90% of chronic illness and disease is due to stress and inflammation in your body.
Right.
Okay.
Okay, thank you.
My oldest patient was 103. My youngest was a newborn baby. So there is no age limit to keeping your spine healthy. And yes, you see a chiropractor even though that you don't have any pain. I don't have any pain, but I still get adjusted once a week.
Okay.
Can I
Okay,
ask
thank
you
you.
a question, please? So the first port of call should be the osteopath, and then they refer you to a chiropractor.
No, you don't have you just walk into a chiropractor. You don't need a referral from anyone.
Oh, I see. But then the chiropractor does the big sort of adjustment, unlike the osteopath, isn't it? So,
No, the treatment a chiropractor would do is different to what a osteopath would do, but again, it's tailored to your condition and to your needs. So there are lots of different techniques that chiropractors utilize. So again, it's a case by case basis. So that's why we do a consultation for you. We ask you lots of questions. We assess your posture. We assess the health of your nervous system through things like testing your muscles, your reflexes, your sensation, because all of that is controlled by the sensory part of your nerves, etc. And then based on that, if we feel you need to have an X-ray taken, then we take an X-ray. Otherwise, if we feel we need an MRI taken, we send you for either through the GP referral or to do a private scan. And then we tell you, this is what we found, this is what we need to do, this is how long it's going to take. And then when we tailor the care based on obviously all of our assessment findings.
and for example, if somebody has got pins and needles now going down to the foot and the foot is numb, could it be because of the sciatic nerve or lack of blood circulation in the leg, or how would you know?
That's why we ask you questions and we do tests. So obviously, if it's a circulation problem, we can assess, well, first of all, we look at your leg or the person's leg to see if it's dark, if it's swollen, if it's hot to touch. Then we check the pulse. So the pulse around the leg. Is the pulse faint? Is it strong, etc.? Then assess whether or not it's a nerve issue. So usually if it's L5 or S1 nerves in the low back, that will trigger pins and needles into your leg. because those nerves control the sensation to your foot. And it's the most common areas for people to get issues at that level.
Okay. Thank you for that.
Okay.
Thank you. Hello. Thank you for a very excellent presentation. I got to know quite a few things. I have a dropped foot, and for 2-3 years now, and the medical people have told me they can't cure it because it's too late. But can a chiropractor help me with that?
I can't say technically yes. However, I can tell you a case study of a gentleman who I helped with a dropped foot. So it was before COVID. He was
Okay, I'm going.
He was a big Polish gentleman. He was 6'2", I believe. And he had a big L5-S1 disc bulge in his low back, which then caused the foot drop.
Okay.
So he was scheduled to have decompressive surgery, which I said you don't need. So it took about 6 months of working with him, and his foot drop basically got better.
Oh, good. Thank you.
You're welcome.
Dr. Zander, in our last session, you mentioned a pillow, and
Yes.
somebody has requested the name of that pillow. Would you kindly give us the name again, please? I think I can't see it. Hold on.
It's a Royal Rest pillow. Can you see?
Yeah. Can I just take a screenshot, please?
Yeah.
I'll take one, two.
Thank you. Okay, if anybody hasn't got any more questions.
May I just say one thing, please? You know, I've always got to say something. With all the list of suggestions you gave us for taking care of ourselves, the one I have the most problem with is trying to consume 2.5 liters of water on top of your cups of tea and whatever other drinks you might have. And I mean, I'm retired, so I'm at home. What about the people who go out to work? How do you manage that?
Again, everyone is different, but it is very important to stay hydrated for lots of reasons, because obviously, like I said, your brain is majority water, your blood vessels, your red blood cells carry all the oxygen that you're breathing in and you're drinking around your body. So it's just something that you have to do. How you do that, it's just a habit to get into. So it's better to sip throughout small sips throughout the day rather than trying to drink obviously everything at once. But you also have to remember that if you're drinking tea or coffee, they act as diuretics. So they actually dehydrate you. So for every tea or coffee you're drinking, if it's caffeinated, you need to drink 2 cups of water to replace the fluid that you're going to be losing.
Isn't 2 liters a bit too much? I was told 1 liter is just enough.
And that's 2.5.
Not 2, dear, 2.5.
Or 2.5. Yeah,
Yes.
that is a bit over.
No, that's the national and international guidelines.
Is it? Okay.
Yes.
Okay. Okay. So what we have learned, self-care strategies.
I have a question.
One more? Yes,
Yeah.
go ahead.
What I would like to say is, would you suggest to go and see a chiropractor once a year, like you do go and see a dentist for a checkup?
It depends on your personal health aims. If you feel that once a year is healthy for you, then by all means, but it's like you going to the gym once a year and expecting results. Honestly, it doesn't do anything.
I'm not ill or anything, but I want to prevent illness. So that's what I'm asking. So just for a normal general checkup. Would you suggest that? It's a good thing or
I
not?
recommend a checkup, yes, to obviously assess the health of your spine, but to see a chiropractor once a year, honestly, doesn't do anything.
Right. So what?
Because going back to what I mentioned earlier about these stages of degeneration, once that vertebra in your spine loses its normal alignment, within a couple of weeks, if not less, it starts to degenerate because the disc starts losing its water and its blood supply through the lack of diffusion. Because when the spine moves naturally, that's how blood, nutrients, and water is diffused and pumped into your disc. So if that joint is restricted, it's not going to move back by itself. So then over time, it starts to get dehydrated and degenerate. Then we got changes in the muscles that surround and attach into that area. So you eventually will get scar tissue that grows around that area, which then further limits how well that joint can move. And then your body, in its amazing wisdom, it knows, okay, this area isn't moving. So what do we have to do? Grow bone, which is osteoarthritis. So that process usually happens without any noticeable pain or symptoms. Same principle as tooth decay. But again, it comes back down to the fact of how healthy do you want your nervous system to be functioning. For me, I don't see the point of having a healthy nervous system once a year. For me, like I said, once a week for me is the most beneficial. And I've had chiropractic my whole life.
Okay, thank you.
I have a question, doctor. If somebody comes to see you and with a long history of osteoarthritis and spinal issues, can they bring all the reports, X-rays, MRI, and everything when they come to see you, or you will start from
No,
again?
we'll do your assessment first of all, and then obviously the more information you can bring, obviously that helps me form a better picture and understanding in terms of obviously what you're presenting with. And then if I need to have for example, a follow-up MRI or follow-up X-ray, so we have a comparison, then obviously that's something we can discuss. But yeah, by all means, bring whatever you want to.
Okay.
Okay, this is where I come in now. Self-care strategies, including posture corrections, simple exercises, and daily habits to help manage or prevent symptoms. Dietary insights that may influence headache patterns. An open Q&A session does help us, offering personalized guidance and practical advice to participants. So it would have been really nice if everybody had their videos on so Dr. Zander could interact and also see your faces. So not forgetting, Dr. van der Waalt's presentations provided not only clinical insight, but also empowering takeaways that attendees can apply in their everyday lives. Thank you to all. But before we say goodbye, I'd like to introduce our president, GAA President Kamlesh, who is online today. Kamlesh, all yours.
Hi, Bana. Hi, Dr. Zander. Can you hear me?
Yes.
Yeah.
Thank you, everyone, for joining. I sort of missed the last few sessions, and I've caught up with on the recordings. But what I've heard, Dr. Zander, is so much information and education, and I can see by the number of participants that people are enjoying your session. So thank you so much for that.
Thank you for having me.
No problems, and we want to have you back as well. We'll give it a few months, but we want to invite you back. And look, for the community, and I don't mean just my community, but generally the wider community. Lovely to see some of our neighbours. So William and Doris, is lovely to hear from you. And I know consuming 2.5 liters of water, Doris, is tough, right? But as Dr. Zander said, it's personal. Carrying a bottle of water around with you is just a simple discipline you can have to sort of try to consume more. But also we know that as we get older, we have a need to go and frequent the toilet more often. So this is the balance as you get older. So it's managing your time and when you consume water as well. There's lots of things. So these sessions are designed just to sort of educate us generally as to how we can operate better. And with that, I wanted to sort of appeal to you and the wider group. What do you want to see from us What do you want to hear from us? Because this is, our fourth session in our health webinars. We're going to continue doing this every week, and there's so many important topics, and we really want that to come from you. What do you want to hear about? What do you want to be educated in? And it doesn't mean we're going to take everything on board, but education is better than having no education. At least we know maybe where we can go. So to give you an idea, what GAA is doing, we're working very, very closely with leading health establishments. So we're going to work with Imperial College and their research teams. They're going to run some of our future sessions with us, both on mental health, cardiovascular health. We're also going to be running research programs for people. You don't have to take part, but if you'd like to, we're going to open up the research facilities at Imperial College for you. Our next session is going to be on bowel health, and there's be an element of screening. So we're going to get St Mark's Hospital, who are based in Acton, the Central Middlesex Hospital. This is going to be next Thursday. We're going to have Brent Health Matters on with St Mark's Hospital, talking about how we can sort of look after our bowel health and how to do screening. I know it sounds a bit awful, but it's actually very, very important to us. We're going to be talking about that next week. We're also going to be working very closely with financial providers. Now, you say, what's finance got to do with health? It's actually to do with well-being. People, Dr. Zander's referred to stress. One of the things that causes stress is people's financial affairs. And as we get a bit older,
Yes.
we tend to forget a little bit about, financial well-being impacts our health. Really impacts our health. So we're going to do a session on that in a few weeks' time as well. But the idea is to come out to the community and ask, what do you want? So please feel free to reach out to Panna, to me, to anyone at GAA, to say, look, this is what we'd like to hear. This is what we'd like to talk about. I'm going to give you some more examples of what we're going to be doing. So, of course, we talked about bowel health. We talked about financial well-being. We're going to be talking about balance and strength of your body. So we're going to get a physiotherapist in. Give me a second. Sorry. Background noise in my end. I think my wife's making dinner. Sorry. We're going to be talking about balance and strength, because people, as you get older, there's a tendency to fall. And it's about perception, dark places, or can't see a step, or it can be a variety of things. So we're going to talk about that and get a specialist in to talk about that for us. We're going to bring nutritionists in as well. Okay, so please feed us what you'd like to hear from us about. We're going to just every week, every Thursday. It's your forum, okay? We're just facilitating this for you. That was my message, really. Thank you.
Thank you, Kamlesh, and thank you to all who joined us for this sessions and throughout the series. Your participants and enthusiasm made these events truly meaningful. And Dr. Zander has been wonderful giving us the informations what we needed. We also extend our heartfelt thanks to him and his valuable time, expertise and commitment to community health and education. So don't forget, next Thursday we're looking into bowel health and screening, which is, Kamlesh said, very important at the moment. At this age, we have to, look into it. Just don't ignore it when you have an envelope delivered in your door. Do look at it and do it, as they say. Thank you very much, Dr. Zander, Kamlesh.
Thank you, everyone.
Thank you all. And thank you all the participants. Take care. We shall catch up next week.
Thank you.
Same timing, same logging in, same ID. Thank you again. Take
Bye.
care. And good night all.
Check it out. See you next week.
Okay.
Thank you.